Well, good morning, sisters and brothers, and thank you to the General President and to the IAFF for giving us the opportunity to give some initial thoughts about the Grenfell Tower fire. It is an investigation that is still underway. It is now the subject of a major public inquiry initiated by the central government in the UK, an inquiry which we will be playing a full part in. The findings that we have at this stage are very provisional, as there is an investigation involving our members and officials in London and nationally, cooperating with the London Fire Brigade. But as you can imagine, an incident on this scale is going to take some considerable time to get to the bottom of exactly what happened and why. The block is based in North Kensington, West London. Interestingly, in the London Borough of Kensington and Chelsea, and one of the sources of debate in the UK around the incident is the fact that Kensington and Chelsea is the second wealthiest borough in the whole country. A borough of very sharp divisions between some of the wealthiest citizens of the country and internationally wealthy people and other people, ordinary working people. Comments have been made about the residents of this block. Just to give you an impression, there are all sorts of people living in the block: professionals, teachers, engineers, and others. Some who were tenants and some who owned the apartments within the block. The London Fire Brigade was called at 0:54 a.m. and as the film explained, was initially to a kitchen fire on the 4th floor. And the early crews arriving within the response standards of the London Fire Brigade believed that they had extinguished that early kitchen fire. However, what happened very quickly is the spread externally around the building, and now we are aware that at least 80 people have died as a result of the fire. The first crews arrived in under 6 minutes, and the resources dispatched by the London Fire Brigade. The London Fire Brigade is the second largest fire service in the UK, the largest being the Scottish Fire and Rescue Service. But in terms of resources and full-time professional firefighters, the London Fire Brigade is the best resourced fire service in the UK. Dispatched something like 60 fire engines in different forms, other appliances, and 250 firefighters attending during the first night of the incident. An issue that strikes us straight away is the question of what would have happened had such an incident occurred elsewhere in the UK, because many of our fire and rescue services would not have the resources that the London Fire Service, the London Fire Brigade, does have. Large numbers of people were rescued. The figures are still being calculated because some people self-evacuated, some people were identified through the fire survival guidance through the London Fire Brigade's emergency fire control. Others were simply approached or found on stairs and corridors by firefighters entering the building. So the detail of what happened: a fire broke out in a kitchen, in a refrigerator, and seems to have exited the kitchen through the window and damaged the cladding to the building, penetrating the detail around the building, and once the fire penetrated the cladding itself caused the fire to spread very rapidly, both up and around the building. When a team of us attended the incident the following day, while some firefighting was still underway, and we thank the London Fire Brigade for their assistance in allowing us to see the building while operations were still underway. And you can see at the corner there, our fire engineer, Dave Sibbott, immediately noticed some unusual design elements around the building. And on each corner, the cladding had been applied using some structural steelwork, effectively creating a box effect at a diagonal angle to each corner of the building. And it immediately struck us that what we had here was a flue effect, a chimney effect on each corner of the building. And additionally, on each 3 points along each face of the building, a similar effect took place in a triangular-shaped pillar, which was again boxed in by the cladding. So 3 points on each face and a larger point at each corner, this flue effect appears to have taken place. The background to this, I think the big question, this is a huge political debate now in the UK, of how in a publicly owned residential building in the second wealthiest borough in the capital city, how can 80 people, at least 80 people, be killed in a fire in 2017? So there is an inquiry, there is a police investigation, and we hope that the people who have made decisions that have led to this will be held to account. But for us as the Fire Brigades Union, there's a deeper question, not the question of simply who put flammable cladding on this particular building, but how is it even possible for people to make decisions that put flammable cladding onto a building in the capital city in the UK. And the background to this for us is 30 years of deregulation under various governments. So the slide there points to a review of fire policy that commenced in 1980 that suggested there was over-provision in terms of fire safety protection within buildings, and that there may be avenues by which fire protection requirements could be reduced. And that's the theme, the political theme that we've faced in the UK Fire and Rescue Service since 1980, going through different phases. The favourite phrase that is used in these discussions is the need to cut red tape. Red tape presented to us by central government as an obstacle to development, something the construction industry doesn't want to see. And of course, for us in the fire sector, in the Fire and Rescue Service, red tape in this case clearly means the difference sometimes between life and death. We also had, we've had difficulties with the Conservative governments. We've also had similar attacks under Labour governments. The Fire and Rescue Services Act 2004 abolished all the structures that had been created within the Fire and Rescue Service after the Second World War, most notably the Central Fire Brigades Advisory Council, a body that helped establish professional standards in the Fire and Rescue Service in the UK, including standards around fire protection in buildings. We saw the abolition of the Fire Inspectorate in England, and the introduction subsequently of the Regulatory Reform Order in 2005, which altered the fire safety regime in buildings. So previously this had been a very inspection-based regime. The regime today is based on self-assessment by the owner. The fire risk responsibility rests with the owner. Fire risk assessors, again, an issue that we've raised in relation to another incident where one of our own members was killed, that fire risk assessors in the UK, there is no regulation of them. People effectively self-appoint as fire risk assessors, tout for business, and can obtain work as a fire risk assessor. The Fire and Rescue Services role is then to audit the work of the fire risk assessors. So the whole drive towards light touch enforcement and inspection is something we want to examine. You then look at the impact of this debate on the fire service in the UK. Between 2011 and 2015, 30% of central funding cut from our fire and rescue services. The impact of that has primarily been on jobs, 11,000 firefighter jobs lost since 2010, about a fifth of the entire workforce. One of the areas particularly hard hit is our fire safety inspecting officers, a specialist part of the Fire and Rescue Service, where the cuts have been proportionally bigger. So huge workloads on our fire safety departments, who are generally uniformed departments, but a particular impact in terms of the reduction in numbers there. We've then faced further challenges, again, the red tape challenge. A big debate in the UK Fire and Rescue Services, the integrated risk management plans, which replaced national standards of fire cover, whereby individual services should risk assess their local community and make plans for how they intend to address those risks in terms of protection, prevention and intervention. Unfortunately, in a climate of endless cuts, what those integrated risk management plans have increasingly become are integrated budget management plans. You have further alterations to the fire protection arrangements, the repeal of sections 20 and 21 of the Buildings Act regarding the exteriors of buildings. We have a government policy in terms of regulation that for any agency wishing to create a regulation, the requirement to remove two others. So anyone who says, well, we'd like to introduce a regulation, the challenge back to you is, well, which two do you want us to get rid of then? The issue of cladding itself, this is a quote from a document we produced in 1999, alerting government and other agencies to the risks potentially posed by external cladding applied to existing buildings. So this is a debate that we've been engaged in for some considerable time. We take no pleasure in having seen some of our warnings brought to light in such a horrendous way. Again, we've a whole history of alerting central government to the concerns we have about this deregulation, lack of oversight, lack of enforcement, going back from 1999, 2006 in this particular case. And here's a series of the warnings that the union has made. It's about time where we challenge the slowing down of emergency response times in the UK. 2010, in response to the government's consultation about central government spending, a service to be proud of, where we warned about the financial impact of this on our fire and rescue service. Again, similar arguments made in 2012, 2013, 2014, 2015. You see the pattern. Unfortunately, those not listened to. So I listened to the earlier presentations, and I think to finish, I've met not all by any means of the firefighters who attended Grenfell Tower. I think many of the experiences that colleagues have outlined in relation to the other incidents this morning are similar to the challenges that our members are facing in the London Fire Brigade. The scale of that incident, I was absolutely, like I'm sure you were, I was shocked at the scale of the incident. I couldn't fathom out how the people in charge actually could make the decisions. Every normal procedure went out the window. Normal safety practices could not be applied. And yet we had firefighters up to the very top of that building very, very late into the incident and continuing to save lives throughout much of that incident. Nevertheless, they saw sights that will never leave them. They had to make decisions in some cases that I think they will never be able to forget. And of course, despite the fact they saved large numbers of lives, the number of people who were killed at that incident, I think, is something that people are only just beginning to face up to. And again, I think the issues of mental health and welfare are matters that we will need to address in great detail. Again, just as an aside, the counselling service in the London Fire Brigade is one where 14 counsellors were previously employed and under cuts forced through by the former Mayor of London, Boris Johnson, now our Foreign Secretary, that was reduced to 2 councillors for a workforce of some 4,500. So the question of mental health awareness and the support for that provided by fire and rescue services is a matter that goes to the heart of some of the issues we're tackling with as well. I think in finishing, for us, Grenfell Tower has to be a turning point. We have a whole history in the UK, and I think indeed internationally, of stable door legislation, or sometimes called tombstone legislation, where it takes horrific incidents for those in authority to wake up to the risks that our communities face. Some of us, the professionals in the service, make those warnings, and unfortunately it takes major incidents for others to take notice. Grenfell Tower needs to be that sort of turning point in the UK, and the Fire Brigades Union will be working with the survivors, with residents, to ensure that that is indeed what happens. I thank you again for your listening to us, and we look forward to working together further with the IAFF on this and other issues. Thank you very much.